Hello everyone. In this video, we are going to discuss about action taken, de-challenge and re-challenge in pharmacovigilance. First, what is meant by the action taken? Action taken is what action was taken with respect to suspect drug when adverse event is occurred. It means due to the appearance of adverse event, what changes made in the dosage of a suspect drug. It is called as a action taken. Action taken can be categorized as dose increase, dose decrease, drug withdrawal, drug temporarily interrupted, unknown or not applicable. Action taken is dose increase if dose of a suspect drug is increased due to the event. Action taken is dose decrease if dose of a suspect drug is decreased due to event. Action taken is considered as drug withdrawal if drug is withdrawn due to the event. Action taken is drug temporarily interrupted if suspect drug temporarily interrupted due to the event. Action taken is considered as unknown if no details are provided on action after occurrence of adverse event. Action taken is not applicable if event outcome is death and it's unknown when the suspect therapy is discontinued. Action taken is not applicable if a single dose is given and never given again. So in these both scenarios, action taken is not applicable. Now moving to de-challenge. What is de-challenge? De-challenge refers to stopping of a drug usually after appearance of adverse event or at the end of a planned therapy. De-challenge can be complete or partial depending on what action taken on a suspect drug. That is, whether the drug is completely withdrawn or dose decrease. De-challenge value indicates either adverse event has disappeared or not after the drug withdrawn or dose decrease. So, de-challenge can be categorized as positive, negative or unknown. Positive de-challenge. If adverse event show the improvement after the drug withdrawal or dose decrease, then de-challenge is considered as a positive. Negative de-challenge. If adverse event did not improve after the drug withdrawal or dose decrease, then de-challenge is considered as a negative. De-challenge is considered as a unknown if information is not provided on status of an event after drug withdrawal or dose decrease. Now, let us understand the concept of de-challenge with an example. Suppose there is a patient who has a urinary tract infection and doctor recommended ampicillin for 2 weeks. But after the administration of a drug, patient develops rashes. Due to the rashes, drug is withdrawn. That is, de-challenge has occurred. Now, if rashes disappear after the drug withdrawn, then de-challenge is considered as positive. But if rashes do not disappear after the drug withdrawal, then in this scenario, de-challenge is considered as a negative. Now coming to the re-challenge. Re-challenge refers to restarting of the same drug after having stopped it, usually for an adverse event. Re-challenge may also be complete or partial. Re-challenge can be categorized as positive, negative or unknown. Positive re-challenge. This refers to the adverse event reoccur after the restarting the drug. To have this occurred, the adverse event had to have previously disappeared after the de-challenge in order to restart it. Here, do not confuse in positive de-challenge and positive re-challenge. With a positive de-challenge, the adverse event disappear. But with a positive re-challenge, the adverse event comes back and vice versa. Now a negative re-challenge. This is the case where adverse event does not reoccur after the drug is restarted. Re-challenge is considered as unknown if it is unknown that adverse event reappear or not after the restarting of a drug. Let us understand the re-challenge with an example. Here we again consider the same example which we have discussed earlier, where drug is withdrawn after the appearance of adverse event. Suppose after the gap of 1 week, if the patient again restart the drug and the rashes reappear, then that situation is considered as a positive re-challenge. And if rashes do not reoccur, then it is considered as a negative re-challenge. Now we will discuss the scenarios where de-challenge and re-challenge is not applicable. First, suspect drug stop before the adverse event onset. Treatment is provided due to the adverse event, or if the action taken is not applicable. What is the importance of de-challenge and re-challenge? De-challenge and re-challenge are very important in causality assessment. Positive re-challenge or de-challenge may suggest strong causal relationship.